Joining me on the show this evening. So, cognitive behavioural therapy, or CBT as we're going to call it now. What is it?
Well, it's a counselling approach that is very much based on dealing with problems as you're experiencing them currently. So, although it takes into account what's happened to you in the past, it's mainly to deal with how you are functioning today in everyday life. So, if you're experiencing stress or depression, and certain things are causing that, it's actually trying to deal with that which is current to you now and the difficulties you're having in the way you're functioning on a day-to-day basis. And also, people worry a lot about the future, but the future is very difficult to predict and lots of factors determine it. So it's very much dealing with the current situation.
Right. So, well, I think that's probably a really good way to approach things as well, because I mean, we're always hearing as well about living in the moment or being in the moment, and I think perhaps, as you've said, people do worry a little bit too much about the future that hasn't even happened yet, or perhaps they're still living in the past as well. So it's nice to feel that you're actually dealing with stuff right here, right now.
And it's an important issue that you've raised about living in the moment, because that is many of the techniques in CBT, like using mindfulness and acceptance and commitment therapy, terms that you may or may not have heard, but they're very much about accepting what you can't change and trying to change with effort and problem solving that which you can influence. So sort of putting your efforts into what you can actually alter. And then there's the aspects of change can be very difficult. It can be risky, it can be difficult to adjust to. You know, when people suffer bereavement, it's a very difficult thing to adjust to. You have to accept the loss eventually, and you have to sort of take action to make changes in your life and to adjust to your life as it is in the present.
So it is about, well, it's about living effectively in the present moment then, isn't it? As effectively as you can.
It is, and trying to be happy and experience joy in what you do, rather than having regrets and wishing that you'd done things differently, or sort of brooding about what's gone before, and whether what you did, whether you could have changed it if you'd done something different, because you can't change the past.
No, absolutely.
And that's quite important to bear in mind when you start looking at your function, how you're functioning in the present day.
So what drew you to CBT then? Why did you decide to go down this route?
Well, I started off working as a counsellor when I did my counselling psychology in about 15 years ago, and so I worked in private practice and the NHS, and in the last 4 or 5 years I've been more interested in cognitive behaviour therapy, or CBT, because I think it's a very well researched, evidence-based approach anyway, lots of random trials. It's really the gold standard of having success with people across a range of problems. But what has particularly interested me has been the shift from just focusing on dysfunctional thoughts to focusing on processes that go across the different types of problems that we experience. So the thoughts about the thoughts, really. So things like worry, brooding, and other sort of carrying out safety behaviours to avoid dealing with issues that like avoidance and procrastination. Often our problems are made much bigger and worse because we do those things, and actually they're very unproductive. We don't ever solve a problem by worrying. We think we do because we think an answer will eventually come to us, but it doesn't, and it just takes a lot of time up, makes you feel more and more depressed because your focus is on those aspects, and you don't really sit down and think, well, what can you do about it? What steps can you take to make changes? What sort of hierarchy do you need to progress through to cope with your stress, in a staged way? So lots of aspects of how you manage are affected by you worrying and brooding, and
Yeah, worry, I think becomes sort of like a big monster inside you, doesn't it? The more you worry, the bigger it becomes, and the more effort you actually make to run away from it. So you practice all sorts of avoidance techniques, if you like. So it's kind of doing anything and everything, so you don't have to focus on that monster that you've got inside your head.
That's right. And we all think our brain is our friend, but actually our brain is not our friend. Our brain can really torture us. It can really turn in on ourselves, that we think badly of ourselves. We can often sort of not think or lack self-confidence because of what we think we're like, or what other people are seeing or making judgments about us. So, our brain isn't our friend. And for people as well who have quite a lot of obsessional type traits, then keep sort of repeating behaviours or rituals that are not sort of helpful to us, checking things, checking windows, checking doors. For some people it becomes a pattern that it takes any length of time to get out, but when it becomes particularly troublesome, it's taking so long to get out of the house because of the rituals you're doing and the checks you've got to make, or so long to cleaning or checking are the two aspects of obsessional compulsive behaviours. And for people who do cleaning, then the contamination fears and spending lots of time hand washing or cleaning, it can actually absorb so much of a big chunk of your life. And
well, it takes over life, I think, doesn't it, to a large degree. That's when you know that it becomes a problem, when it really does take over a huge part of your life and it actually stops you performing normal day-to-day activities. Right. It stops you kind of going out to see friends, stops you going out to the shops, because by the time you've done all of that, it's too late, and you can't go out of the house anyway. So it's about being able to live life more effectively and not have all of those kind of controls in place, those obsessive compulsive controls that people put in their way. So yes, it's fascinating. So would you use this instead of counselling, or as well as, or?
It's a counselling approach, really. And as I say, it's becoming much more popular, much more well known about, but it's actually been going since the early 70s, or even before, in terms of the philosophers that said things like, it's not the event that happens, it's the way we think about it that causes our distress. And so for most aspects of psychological distress, the approach is helpful, and as I say, it's evidence-based that it's helpful. People learn coping strategies for the future, so it's not just a one-off that you have to engage necessarily in therapy again, although you may want to, but you do learn strategies to cope better for the future and to deal with those issues more effectively when they arise again. So there's a teaching aspect to it, in respect of that you are learning how to deal with situations that are similar, and that may crop up again in your life.
Right. So you've mentioned there are things like OCD, also stress, all kinds of things associated with stress as well. So what else can it actually help? What can CBT help?
Well, those stress and depression are probably the most common problems people come along with. It's often a range of things that result in that feeling or that effect. So things like eating disorders, things like paranoid type thinking, things like sexual problems, relationship difficulties, family problems, people not communicating, so anger management. So lots of things sort of contribute to the overall mood or the overall stress experience that the person has. Changes in life, bereavement particularly. Dementia is an increase of referrals with people with dementia, both for the person who's suffering from the dementia and also the carers is becoming more common, because obviously the dementia is becoming more common.
Yeah,
and most of us know somebody with dementia.
Just to kind of interject there, dementia is an interesting one, because I know obviously it's a very common problem now, but isn't dementia actually a physical condition where the brain is deteriorating? So how can therapy help with something that's actually kind of becoming less, if you like, the brain is becoming less active?
Well, dementia itself has been a bit like a hot potato thrown between community and mental health services and acute services for a considerable number of years. But because dementia often results in some behavioural problems, it has sort of tended to drift more to mental health services. But in terms of cognitive behaviour therapy, it's been more around people experiencing anxiety and depression as a result of the diagnosis, families having difficulties in terms of coping with often difficult or challenging behaviours as the disease progresses. So it can be quite a difficult, debilitating condition, and people can need quite a lot of support in coping, in looking at coping strategies, in helping sort of promote memory aids to help the person in the mild stages, trying to tag certain events and certain happenings in their life. So it can be quite useful, particularly with helping people cope with the depression and anxiety that often goes with the realisation of what's happening as the slow progressive disease starts to take hold.
I don't know whether this is linked at all, but I know there was a programme on TV, or it must have been a few years ago now, where they had several kind of celebrities on the show who were quite elderly, and they gave them kind of things to do and tasks to do and things to think about, whereas they'd had carers looking after them. And when they were given the tasks to do, their mental abilities actually improved significantly because they were kind of given their minds back, given their own judgment back, whereas with kind of being overwhelmed with carers and people around them looking after them, they kind of gone into themselves. Is that something that CBT will be looking to do? It's kind of giving them their independence back, if you like.
I think it's sort of more difficult when the person starts to lose their higher order cognitive ability, because to actually memorise, to recall, to hold on to some of those concepts can be quite difficult. But certainly in terms of memory rehearsal and trying to sort of slow down the process of the illness, as the drugs do. Anti-dementia drugs slow down the process, and people seem to hold on more to their sort of positive behaviours and etc. But memory, I think, is like many bodily functions, that if you don't use it, you lose it. And I think all of us that haven't necessarily got memory problems notice that when we go on holiday and perhaps are not so active in recalling the days of the week and news items, and that memory starts to deteriorate. But of course, with us living longer, then the likelihood of getting dementia is much higher the older you get. It doesn't cause dementia, but the likelihood of you getting it is much higher.
Well, I guess it's the brain is just wearing out, the same as various other parts of the body wear out. It's just kind of age-related, isn't it? Obviously,
it is. And the different types of dementia means that more space is taken up with these sorts of disease processes, like PICs and
that's different processes, different things that happen.
Plaques and tangles. That's what I was trying to think of. Because the number of those relates to the degree of dementia, because they take up the space and they cause the brain cells to die off. So it's not just the aging brain, but more the changes in the brain and atrophy, and where the brain shrinks, etc. But yes, I mean, there is a place for CBT, but obviously
it can't work miracles.
The level of care needs to
that's right,
increase, and the level of support to carers, the level of support to the sufferer of dementia has to change as
themselves. And when do you consider that the problem's gone too far, that professional help is needed?
Well, I think it's important what you were talking about earlier about the healthy lifestyle, and ensuring that you eat healthily, that you exercise, that you try and make your days interesting, that you do purposeful activity, that you're not just sitting around thinking about your problems, but you are actively participating in the day, that you're having a good support network, so friendships, hobbies, interests, all of those things which we tend to know helps us sort of function well and our life to be interesting. But I think also there's aspects of sort of having or managing your stress effectively. Sorry, I had a bit of a thought block. But managing your stress effectively, because stress is inherent in life, so we walk out of the door in the morning and stress hits us in all forms. But some people manage stress in a healthy way and some people in an unhealthy way. So we all have different size, I call it fish tanks, which are to contain our stress. And the fish tanks build up and up and up, and we have to do something about it as the stress levels rise.
So what's the difference between kind of a healthy way of managing stress and an unhealthy way then?
Well, things that people do, like exercise, talking to people, going on holiday, perhaps being pampered, going shopping, are all ways that can relieve stress in quite a healthy way. Whereas,
like the last one, retail therapy, very good.
Unless it becomes an addiction, obviously it's not so good. But the unhealthy ways are obviously the excessive drinking, smoking, things that actually in the longer term are going, and people often do when they're highly stressed, resort to those things.
It becomes
overeating.
Quite self-destructive, doesn't it?
It does, yes. And there's consequences to it. If you keep overeating, binge eating, then you end up with a problem of obesity. If you smoke too much, you end up with COPD or something that limits your activities. So there's consequences to unhealthy managing of stress. But the trouble is with stress, it seldom hits us singularly. So with stress, you can it's cumulative in the effect it has on us. So one thing happens to you and you cope reasonably well, but 2 and 3 things, particularly major things, moving house, relationships breaking up, losing somebody close to you, then the effect of that on you is cumulative. So you cope less well. And obviously if your stress levels get too high, then there's the risk of breakdown. The sort of layman's term that I'm having a breakdown, which often means that you become mentally unwell, or you may cope with your stress by getting very angry, throwing your toys out the pram and screaming at everybody or breaking things. So it then tends to have a bad effect if you let stress levels get out of control. And you can manage your stress levels by going down the healthy routes rather than choosing the unhealthy routes. And it's very difficult because people resort to those because it may numb the feelings. Alcohol tends to numb the feelings, tends to disconnect us with the reality. So there are reasons why people opt for the unhealthy options rather than get out there and get down the gym and get round to talking to people about the difficulties. So we don't tend to necessarily opt for that which is good for us under times of stress. The same with depression. If you sit at home all day on your own thinking about your problems, not having any social contact, not participating in things during the day, not doing the things you used to enjoy, it's a downward struggle, really.
So when would it be that somebody needs to recognise that they're not coping very well and that they need to seek help from somebody like yourself?
Well, I think it's sort of related to the amount it's affecting your day and how your performance of your day is affected. So if you find yourself becoming more depressed, if you find your stress levels out of control so that you're not managing to perform as you are required to perform in your job, people quite often come along with work stress, and my job really is to try and look at the problems overall and how they interconnect and the effect they're having. So people often have a problem or a series of problems, and then that problem then is affected by what triggers it, and then what triggers it tends to feed into your belief systems. So if you believe you're inadequate and you can't cope with it, or that you can't live without the person you've lost, then that affects the response. So then the response might be, I just can't do anything. I'm never going to be able to function normally again. I'm never going to be happy. And then in the short term, you might decide to withdraw into yourself, not to mix with people, to take the easier path because it's not so stressful at that point. But obviously the longer term consequences of that is you become more and more isolated, your days become more and more meaningless as time goes on, and you become more and more within yourself. And you know, lots of people need to be part of a social network and part of life and what goes on in life.
Well, certainly, I know I've talked about before on the show different surveys, different pieces of research that have been done where it is so important for people to be connecting with other people, which is why it's good for them to have kind of a little community around them. Going to church, for instance, you know, with that church community, feeling that they belong, or going to a social club or some sort of social activity, belonging to some sort of, I don't know, art class or, you know, other sort of activity in that way. Very, very important for making people feel that they belong, because I think there's this need really to fit in somewhere. We all of us like to feel that we belong, and if we become separated from that group, if we become isolated, then we just don't function very well. We're kind of pack animals really, aren't we? We need to socialise.
And people often sort of have to make a decision about whether, I mean, the tradition of sort of men just coping, not showing their emotions, perhaps just going off down the pub, and women showing their emotions but finding it easier to talk about. But actually the view that I don't need help, we can manage, you know, it's not bad enough. But actually the first and the biggest step is to realise that it is out of control, and that your day isn't as you would like it, and that you're short on happiness, and there's no fun anymore in your life.
Yeah.
And what I tend to do is to do this formulation or assessment where I piece it together like a jigsaw, try and explain it in a way that's understandable, and collaboratively work with the client to work that up, and so that we have a clear picture of the short-term benefit of being like that and the long-term consequences of not changing. Particularly with addictions, and you know, it's sort of the short-termism is that yes, the craving goes away because I'm having another fix or I'm having another drink, but in the long term, the destruction in the relationships, the difficulty in bringing a habit under control, it just snowballs. And so my sort of job is around making sense of it, and then trying to look at treatment regimes that can tackle some of these different issues that it can help, Jenny. But what specifically would you offer? What types of treatment would you offer for different problems? For instance, if somebody came to you suffering from depression, what would you do? Well, because depression is like an umbrella term, and what people are saying is this is the feeling I'm having, but what I would be trying to look at is the mechanics of the problem. How does it work? What contributes to it? And often what people bring along isn't actually what the main problem is. You know, people who perhaps feel depressed, when you track it back, it might be to do with work stress, it might be to do with an alcohol problem, it might be to do with family relationships that where there's hostility. So the fact that somebody comes along saying I'm depressed and can't cope, and I've been put on perhaps antidepressants by the GP, it in a way is just a symptom that's representative of problems going on. So the first and most important aspect is to do a thorough assessment or develop a formulation which is about knowing and collaboratively working together to find out how the problems work together, the mechanics of the problems. Once that's been decided, then there's many different techniques that relate to the different problems that people can present, and some of them are slightly different. You know, some treatment that you might offer, or a therapy program that you might offer for something like a sexual problem might be quite different to something that you would offer for something like bereavement. But there could be similarities, because sometimes the thoughts are what are actually causing the problems. So the thoughts about the thoughts that I mentioned earlier. And sometimes people get very fixed in their way of thinking instead of being flexible in the way they think, and as with the techniques of mindfulness, where you accept that thoughts come and go, that you can't necessarily control thoughts. If you try and control thoughts, it's a bit like me saying to you, I don't want you to think about the pink elephant in the room. Immediately it fires up the thought, doesn't it? And it's very difficult then to carry on talking without you visualising this pink elephant. And so it's important to recognise that thoughts will come and go, and that everybody goes up to the top of a tall building, looks over and thinks, my God, I wonder what it would be like to fall. Or on a railway station when a train comes past at high speed. So it's not abnormal to have strange thoughts that are not that rational. But it's if we, rather than let the thoughts come and go, like visitors, if we start dwelling on those thoughts and we get hung up on dwelling, that's when problems start to erupt, because thoughts are just thoughts.
What about something that's more specific then, when people are actually doing things like OCD, because that's a behavioural thing, isn't it? It's not just thinking, that's actually doing, isn't it, as well? So how would you approach that?
Well, with OCD, often people have what they call an inflated responsibility. So they think that that they are responsible for the outcome of things. So unless they check the door numerous times or check the windows, that they'll be responsible if there's a break-in. So, or if they don't check that there's not a leaky tap or a drip on the tap, it would mean that if there was a flood, it would be their fault for not checking it. So people with OCD tend to have an inflated responsibility, and also they tend to be not really sort of live well with uncertainty. So they have a very low tolerance of uncertainty, and therefore to make things more certain, they believe that they've got to keep checking or got to keep washing, because that equals greater certainty.
Right.
In fact, it doesn't, because the more you do it, the more you think you've got to do it, the more worried you get about it. And so, like with some of the other conditions we've talked about, what to tackle is the ability to think flexibly as opposed to rigidly and inflexibly. And once people with OCD can start to accept that they need to be exposed to these things without responding. So there needs to be, if you are wanting to check the door, then you stay with that thought and you don't react. So it's response prevention, and so you it's repeated repetitive exposure to that stimulus and not responding. And if you can manage your thoughts flexibly, then you can switch thoughts, you can distract, etc. You can manage to not dwell to the extent it makes you distressed.
So, and just moving quickly on, because we're just going to come to a roundup and towards the end of the show now. Another interesting one that we haven't touched on is eating disorders. I mean, that's quite common, isn't it? Especially in the sort of like teenage girls, I would imagine. So how would CBT help with something like that?
Well, with CBT and eating disorders, obviously the most common eating disorder that sometimes is recognised as an eating disorder or not is the growing problem of obesity and aspects of control, because people often feel when they've got an eating disorder that their control has been thwarted, whether it's that they have a body image that is skewed. Sometimes people who've got anorexia or sort of look in the mirror and they don't see the size they are. Some people who are obese don't see the size they are. Our brain tends to adjust, and it's often once people lose a lot of weight that they recognise the size they were. But our brain seems to compensate by not really seeing what is the actual dimensions of the person. And so sort of programs to, obviously with anorexia, if the person is grossly underweight, you have got to sort of seek specialist help to try and gain some weight to get the person, or to prevent them starving to death. And often challenging the thoughts, etc., are a really important part of that.
Yeah. Well, it's fascinating. It's been really interesting talking to you this evening. So how would somebody go about contacting a CBT therapist or somebody like yourself? What would they do?
Well, people advertise in different formats, but I think one of the safest ways to make sure you're getting an accredited CBT practitioner is to go through the professional body, which is the British Association of Behaviour and Cognitive Psychotherapists. So most people who are therapists using the approach will be accredited, which means that they have to follow professional criteria to remain accredited. Supervision, they have to be on the register. So I myself, for example, are on the full listing, so you can find somebody there. And obviously there are other advertising formats people might follow, like the counselling directory, but just to make sure that you get the right person for you, somebody who's got some experience, who are fully accredited. And
know that they can cope with whatever their specialist area is, whatever their problem is. Do people specialise in certain things? Do they?
People do tend to tend to do research in those areas or have publications. So, but it doesn't necessarily rule out dealing with other problems. And I say my particular interest is in dealing with the things that go across the diagnosis, that like the worry and the brooding, ruminating, etc.
Right, that's brilliant. Great, okay then, so we can look at your website, which is www.jennyrooks.co.uk, or the counselling directory. Great. Well, it's been fascinating talking to you this evening, Jenny. It's been really brilliant. And if any of you have got any questions about CBT or anything like that, you can always contact me again at Phoenix FM, and I'll be more than happy to pass your questions, etc., on to Jenny. So thank you once again for joining me this evening.